Good morning. Appreciate you being here and the opportunity to share my thoughts on this topic with you. For starters, we're sort of sitting in a place on the other side of the pandemic. We feel like we've come through to the other side, but it's still with us. So for a little bit of context, see if our slides are working. Some of you may remember these kinds of events, going to the grocery store, if you went at all, and avoiding other people as you go through the aisles. Those who may have owned stock in Instacart at the time probably did rather well for food deliveries. I don't know, I may be the only one here who remembers that this is a takeoff on the old video game Pac-Man, which was one of the originals. But this is sort of where we are now. As the cartoon says, it's nice, the pandemic is all behind us now and we can get together again, but we're dealing with new variants, as we know, and vaccination is still the most important tool that we have to deal with Omicron variants and others, and going forward in what some people call the new normal. So what I'm going to do today is first give a few statistics about vaccination rates, that being suboptimal, especially for adolescents. Talk about parental vaccine hesitancy as an obstacle to increased vaccination. But also, in relation to that, the fact that the current law gives legal rights to parents to control their child's health care, with some notable exceptions, but that parents control vaccination decisions for their kids. So the next piece of the presentation and the argument, so to speak, is that adolescents at around age 14 possess the maturity and capacity to consent to vaccination. And that we need law reform to give autonomous adolescents the right to decide over parental objection, to authorize pediatricians to rely on that consent, and to promote patient and public health. So before I get into that more deeply, I just want to say that my remarks are based in part on this paper that was published in Public Health Reports in 2021. I want to acknowledge my co-authors, Tony Yang, who's at GW, Yana Shaw, who is at my former institution, SUNY Upstate Medical University in Syracuse. And some of my remarks are also going to pick up on a paper expanding on these ideas that actually was just accepted for publication this past week. So we're happy about that. So I'll take a deeper dive drawing on that work into sources of parental vaccine hesitancy and issues surrounding adolescent maturity and consent. So some stats, there are approximately 25 million adolescents aged 12 to 17 in the US. As of February 8th of this year, vaccination rates for the initial series for adolescents stood at 62%. Rates for first boosters only at 20%, according to CDC tracking data. And here's an example at the bottom. Rates for older age cohorts are significantly higher. Ages 18 to 49 is 71%, first booster at 30%. Those vaccination rates actually are higher as we go to higher older age cohorts. So a quick look at parental authority under the law. Parents have time-honored rights and obligations to raise children and make decisions for minor children, including in healthcare, and broad discretion to decide in their child's best interests. The prevailing view that we've had for many years is that we trust parents to act in their child's best interests, and all of us who are parents understand where that is coming from. Parents have routinely followed pediatrician recommendations for vaccination, but there has been an erosion of that decision and that trust in pediatric recommendations, public health recommendations in recent times, especially with COVID. I would note the age of majority is 18 in virtually every state in the country. For some reason, it's 19 in Alabama. Don't ask me why that is. But the point is that anyone under 18, that's where parental authority rests. Legally, the term would be that those are minors, age of majority, again, being 18 virtually everywhere in the country. Looking at parental vaccine hesitancy, drawing on some of the work that's been done in this area, a sociologist who's looked extensively at parental vaccine hesitancy coins the phrase individualist parenting. It's the idea not just that parent knows best, which we all understand and appreciate, but with COVID-19 in particular, but also historically with other vaccinations, this charts a different course and takes us into the territory which is familiar from the media, distrust of science, public health officials, drug companies, and others, misunderstanding and disinformation, much of which comes from social media, the belief that vaccines are risky, not effective, with the mRNA vaccines, the concern that it's new and untested, and it did get developed and become available a much faster track than vaccines historically. The view that natural infection immunity is safer and more protective than the vaccines. We've had issues of politicization of vaccines. There's a strong correlation with self-consent and self-refusal. So if parents make the decision for themselves, they tend to make the same decision for their kids. And lastly, there's the idea of a right to medical freedom, which, to put that in a little bit of context, basically means, on the one hand, I, as an individual, as a patient, can refuse vaccination, but the problem is, are there limits to your freedom to refuse vaccination? So if we indulge a little bit of philosophy here, the famous British philosopher John Stuart Mill gave us the harm principle, the idea that we should have a society which promotes maximal freedom for individuals, but one person's freedom ends where harm to another person begins. So this is a sort of an underlying theme that runs through not only vaccination, but obviously through issues that we've had regarding masking and social distancing and so forth. And I will add that while this list of information about parental vaccine hesitancy can be found and has been found a lot in the popular media, there are a lot of more rigorous studies and surveys that have been done that look at these things. One important source would be, for example, if you're interested, the Kaiser Family Foundation that tracks attitudes towards COVID vaccination, COVID generally, and has been doing so over time. So what about the right of adolescents to choose vaccination? Well, there's no generalized right of consent. There is clear authority for COVID-19 in a handful of places. Handful of states allow for any recommended vaccinations. So, for example, Oregon and South Carolina, Philadelphia and San Francisco adopted citywide rules specific to COVID-19. DC, a couple years ago, adopted a law that says any recommended vaccine that an adolescent as young as 11 can make that decision in conjunction with and partnership with their doctor, and that would cover COVID-19 as well. Another example of where adolescents have some recognized legal authority to make their own vaccine decisions without parental involvement would be the HPV vaccine, but that exists, again, in a small number of states as a parallel. There is a question out there that is debated, so to speak, among legal scholars and those who have looked at the state of the law. The question is vaccination routine general medical care? So there are a number of states, I'm going to say maybe up to 20, that have enacted laws that allow adolescents to make routine medical care decisions. Sometimes the term is general medical care. If you ask pediatricians, they would say that it is standard of care and therefore routine to offer approved vaccinations for their adolescent patients. But there's an absence of consensus about that interpretation. The prevailing view seems to be that the right of independent adolescent consent requires specific legal support. And so a little more support for that idea. The title, "Do U.S. teens have the right to be vaccinated against their parents' will?" depends on where they live, and that's very much the case, as I was just sort of laying out. This was interesting. This was a study done by CNN, where they asked public health departments across the country whether their law would support adolescent consent to vaccination for COVID. And the title of the report was, "Most states require parental consent for COVID-19 shots for ages 12 to 15, but not all, excuse me." And here's the list. And the list was in the 40s in terms of how many states would require parental consent. So if public health departments are not interpreting their local law to support adolescent consent apart from their parents, then that's a pretty strong indication that there's a need to change the law, or at least to change that interpretation. Okay, so we do have a number of other areas where we have long recognized there's a national consensus for adolescent control of their own health care before age 18. We have status exceptions, for example, those who are married or emancipated. We have laws that allow adolescents to make their own decisions based on specific health concerns. Those would include sexually transmitted infections, for example, HIV testing, reproductive health, substance abuse, outpatient mental health. Could add a couple more things to this list. And those laws vary in terms of what age the patient would have to be. From age 12 to 16 basically is the window. The rationale for these laws is a recognition that confidentiality is really important for teenagers, that if they can't make these decisions in the privacy of the doctor-patient relationship, they might not present to the healthcare system for care at all. They might not be honest and fully disclosing with their doctor, and that would be detrimental both to patient health and to public health. What these laws also recognize is that adolescents of this age can make these sorts of decisions if they are mature and can act autonomously. And a little bit on that process and how that would be determined. It is an individual patient assessment. It's not a blanket assessment based solely on age. Adolescent maturity is a developmental concept. With wide consensus, adolescents can make a lot of decisions before age 18. Indicia of maturity that the law recognizes, that is recognized commonly in practice and from a lot of medical groups, include age, experience in school, work, social, family situation, demonstrated autonomy and moral agency, and including the demonstrated ability to understand and reason about relevant information. And this would be something that the pediatrician or the pediatric team would be looking at. So in terms of informed consent to vaccination, demonstrated ability to understand and reason, that's decisional capacity, about the nature, risks, benefits, and burdens of vaccination, including the choice of no vaccination, and to make and express an informed decision. From the point of view of the pediatrician or the pediatric team, we have to pay attention to what's going on in the pediatrician, patient, and parent relationship. There are dual obligations. The doctor should, of course, always be patient-centered, should pay attention to respecting patient autonomy and promoting the patient's best interests. But there are also duties to parents, especially when they hold legal authority to make decisions for their kids. Maintaining a bond of trust with both patients and parents is a critical thing. Many pediatricians will begin to have what are known as confidential health visits with their patients, maybe around age 11, 12, 14, depending upon the patient, have private conversations, which can be a vehicle for facilitating informed consent, or as the case may be, assent or cooperation with the healthcare decision. When adolescents and parents disagree, which is the context for what we're talking about, you have to pay a lot of attention to family dynamics. So that would be part of what would happen in the confidential health visits, as well as other communications within the triad relationship. So going back to the reasons that parents are hesitant about vaccination for themselves and their children, one point here would be adolescents can make a different choice. I trust science and my doctor. The benefits outweigh the risks. I want to protect others, family and friends. And in fact, concern for the welfare of others is often identified as an important indicator of maturity. Adolescents could say this is a health issue, a public health issue. It's not about politics. They could say, I don't want to wait and see, which is something that teens have complained about in terms of their parents who are opposed to vaccination. In summary, the adolescent patient can have their own risk budget and assess the information differently in the process of informed consent. For the pediatrician, there can be this further dilemma. You have to ask, it's ethical, but is it legal? To respect and facilitate patient autonomy and promote the patient's best interest, absent contraindications, that would lead to a recommendation for vaccination. But compliance with parents' legal right to refuse vaccination can conflict with this ethical obligation to the patient. So pediatric professionals may experience moral distress due to external constraints of the law, and also have to be concerned with potential damage to the bond of trust, and even the risk that parents may decide to terminate that relationship and find another pediatrician. So in conclusion, the policy prescription here is that law reform is needed to recognize adolescents' right to choose COVID-19 vaccination over parental objection, and to authorize pediatric healthcare providers to rely on adolescent consent to vaccinate. And this would be something that would need to happen at the state level. Thank you.
All right, I'm going to open the floor for questions, and I'm going to check the Q&A area as well.
And you want to pull.
Oh, go to the internet. Yeah, there it is. Okay. Okay. All right, thank you. Let's see if there are any questions in here. Okay. All right, I don't see any questions. All right, I don't see any questions, so that concludes this session. Thank you so much to our speaker and to our attendees. Thank you.